Hi, my name is Maddie Nance. Today I will be reviewing my third article relating to my NICU education project. So for this article, it is titled Decreasing Unplanned Extubations in the NICU, an Ongoing Quality Improvement Project. So the article starts off by describing a 22-bed level 3 NICU where the unplanned extubation rate was 4.6 per 100 ventilator days. The article mentions that after a safety bundle was utilized, the rate decreased from 4.6 to only 2 unplanned extubations per 100 ventilator days. So the article states many different causes of unplanned extubations. So these were things ranging from inadequate staff education, poor taping or fixation of the ET tube, lack of sedation, the small size of the patients, and just typical routine nursing care such as suctioning or repositioning. The article mentions a shocking financial consequence of unplanned extubations, stating that a single unplanned extubation can lead to a cost of $50,000. The article addresses taping as a significant factor in unplanned extubations, and that without proper technique and standards, then we risk the tape becoming loose or moist. The article mentions that this is an ongoing issue in NICUs across the world and something that my current unit has also dealt with. So the article goes on to mention many different methods and brands of taping, the ET tube, which included Neobars and a brand called Marpac tape, both of which have been used in my current hospital, and Marpac being what we currently use in our NICU. The article stated that the Marpac tape was efficient. However, the humidity in the isolates for our extremely premature infants made the tape loose and slippery, all of which issues we have dealt with in our NICU as well when it comes to unplanned extubations. So I found this interesting that this was also reviewed in the article. And then the article also mentions the success of another brand called the Neofit, which I found interesting. So the article highlighted safety standards such as two-person repositioning for all types of manipulation, repositioning, X-rays, or other type of nursing bedside procedures, similar to what I mentioned in my unplanned extubation safety bundle to prevent adverse events. Documentation was also highlighted similarly to my bundle, where nurses are encouraged to perform at least hourly safety checks and pain and sedation scoring. Measurements of the ET tube as a standard and having the depth and tube size at the bedside on a card was something that the article addressed, which I actually did include on my safety bundle as well for our unit. And I thought this was important so that everyone else on the healthcare team can visually see where the ET tube should measure in case the primary nurse is not at the bedside. The article also mentions the importance of debriefing and safety reports from the healthcare team in preventing unplanned extubations in the future. So having staff feedback is important in addressing and fixing future issues. And this is something too that I have tried to incorporate in my project so that everyone's thoughts and concerns can be heard when it comes to creating a safety bundle for unplanned extubations in my unit. The article addresses that there were learning curves with the education and safety bundle, and that over time education must continue for rates to improve even further. But overall, the article discusses that we must continue to advocate for education regarding unplanned extubations in order to improve patient outcomes and reduce hospital costs. Having a standardized practice bundle like the one I created for our NICU nurses badges and the badge buddies will hopefully create an organized checklist for safety and prevent unplanned extubations in my NICU unit. Thank you for watching my discussion.